The following is the ICD-10 presentation for other diseases of the upper respiratory tract. Other diseases of the upper respiratory tract are categorized between J30 and J39. J30 is vasomotor and allergic rhinitis. J30.0 is vasomotor rhinitis. 30.1, allergic rhinitis due to pollen. 0.2, other seasonal allergic rhinitis. 0.5, allergic rhinitis due to food. 0.8, other allergic rhinitis. And from here you need a fifth character. So 0.81 is allergic rhinitis due to animal hair and dander, and it's specifically cat and dog. We don't deal with a lot of other animal dander allergies. J30.89 is other allergic rhinitis, and then J30.9 is allergic rhinitis, unspecified. J31 is chronic rhinitis, nasopharyngitis, and pharyngitis. It needs a fourth character and an additional code to identify exposure to tobacco smoke. J30.1 is chronic rhinitis, and it excludes allergic rhinitis and vasomotor rhinitis. J31.1 is chronic nasopharyngitis. J31.2 is chronic pharyngitis. J32 is chronic sinusitis, and again it needs a fourth character and an additional code to identify exposure to tobacco smoke. So 0.0 is chronic maxillary sinusitis. 0.1, chronic frontal sinusitis. 0.2, chronic ethmoidal sinusitis. 0.3, chronic sphenoidal sinusitis. And 0.4, chronic pansinusitis. And again, everything ending in 0.9 in ICD-10, as a general rule, is that diagnosis unspecified, as is the case here. J32.9, chronic sinusitis, unspecified. J33 is nasal polyps. You need a fourth character and again an additional code to identify exposure to tobacco smoke. So J33.0 is polyp of nasal cavity. J33.1, polypoid sinus degeneration. J33.8, other polyp of sinus. And J33.9, nasal polyp, unspecified. J34, other and unspecified disorders of nose and nasal sinuses. It needs a fourth character. So J34.0 is abscess, furuncle, and carbuncle of nose. J34.1, cyst and mucocele of nose and nasal sinus. J34.2, deviated nasal septum, and this excludes congenital deviated nasal septum, which is Q67.4. J34.3 is hypertrophy of nasal turbinates. J34.8, other specified disorders of nose and nasal sinus. You're going to need a fifth character here. So 0.81 is nasal mucositis, and it excludes gastrointestinal mucositis and everywhere that's not nasal mucositis. J34.89, other specified disorders of nose and nasal sinuses. And J34.9, unspecified disorder of nose and nasal sinuses. J35, chronic diseases of tonsils and adenoids. Again, you're going to need a fourth character and an additional code to identify environmental tobacco smoke in perinatal period, history of use, occupational exposure. J35.0 is chronic tonsillitis and adenoiditis. Now, when you get into the diseases of the tonsils and adenoids, they follow a pattern. So you have the individual diagnosis for the tonsils and then the adenoids, and then there's an additional code for the both together at the same time. So you don't use two codes, you use one. J35.01 is chronic tonsillitis. J35.02 is chronic adenoiditis. And J35.03 is chronic tonsillitis and adenoiditis. J35.1 is hypertrophy of tonsils. J35.2 is hypertrophy of adenoids. J35.3, as you've probably guessed, is hypertrophy of tonsils with hypertrophy of adenoids. J35.8 is other chronic diseases of tonsils and adenoids. And J35.9 is chronic disease of tonsils and adenoids, unspecified. J36 is a peritonsillar abscess. You're going to use an additional code to identify the infectious agent. J37 is chronic laryngitis and laryngotracheitis. Again, an additional fourth character. and an additional code to identify any exposure to tobacco smoke. So J37.0, laryngitis. J37.1, chronic laryngotracheitis. J38. This is diseases of vocal cords and larynx, not elsewhere classified. Again, we're going to need a fourth code and a code to identify exposure to tobacco smoke. Paralysis of vocal cords and larynx. And that fifth character is going to identify what side is paralyzed or if both are paralyzed. So J38.00, paralysis of vocal cords and larynx, unspecified. J38.01, paralysis of vocal cords and larynx, unilateral. J38.02, paralysis of vocal cords and larynx, bilateral. J38.1 is a polyp of the vocal cords, and J38.2 is nodes of the vocal cords, like singer's nodes. J38.3 is other diseases of the vocal cords. J38.4 is the edema of larynx. It excludes acute obstructive laryngitis and edematous laryngitis. J38.5 is laryngeal spasm. J38.6 is stenosis of larynx. J38.7 is other diseases of the larynx. J39, other diseases of the respiratory tract. It needs a fourth character. J39.0 is retropharyngeal and parapharyngeal abscess. J39.1, other abscess of pharynx. J39.2, other diseases of pharynx. J39.3, upper respiratory tract hypersensitivity reaction, site unspecified. J39.8, other specified diseases of upper respiratory tract. And J39.9, disease of upper respiratory tract, unspecified.